Hi everybody, I'm Dr. Scout from LGBT HealthLink. Every week we pour over not only a bunch of headlines, but we also read a bunch of really dense medical articles on LGBT health and wellness. Why? So you don't have to, first of all, but also because we think for our communities especially, information is healthy for us. So let's get right to it. Let's find out what all the top news is for the week of April 18th, 2015. In our first story this week, all 9 DC City Council members have co-sponsored a bill requiring the city's healthcare professionals to get training on LGBTQ health issues. David Grosso, a co-writer of the proposal, said, quote, over 66,000 LGBTQ resident citizens reside in DC, and they deserve to get access to medical professionals who are sensitive and knowledgeable about the unique health needs of our community. DC definitely has the right idea. Now we'd just love to see this actually not only be passed there, but go everywhere else as well. Next up, new guidelines for cancer care providers were recently published on how to make medical care better for LGBTQ patients. Yay! Recommendations included creating gender-neutral forms, asking all patients about sexual orientation and gender identity to gauge cancer risk, and getting accurate training on LGBTQ-specific issues and health inequalities. Frankly, these should go for all health providers, so we give it double thumbs up. Next story, after the Justice Department ruled in favor of the rights of trans inmates last week, the state of Georgia announced a change in its prison policy for trans medical care. It will allow continuing hormone therapy for new inmates and promising to give them constitutionally appropriate medical and mental health treatment. I guess this is better late than never, but seriously, we need a whole lot more trans prison reform pretty quickly. And next, a new study of training programs found that physician's assistants also aren't getting enough LGBTQ sexual health training. On average, physician's assistants received only 12 hours of sexual health training, and unsurprisingly, 38% of the programs said that they covered LGBT-specific topics only poorly or not at all. Sadly, we aren't surprised. We're praying for the day when medical programs realize that our health is also a priority. Yesterday, the feds released data showing that e-cigarette use among youth has tripled over the last year. This is a special concern for our youth because our communities already have smoking rates 50% higher than others. Unfortunately, this survey didn't ask if the youth were LGBTQ. So we're left with yet another concern, and again, no data to prove how we're affected. So we have one message: please collect data on us now. Next, we love the Center for Excellence in Transgender Health for many things, but one is their annual National Transgender Health Summit. This year, the summit is sold out early, so if you weren't one of the hundreds gathering right now in San Francisco, we're hoping we can score some juicy highlights to share with you next week. And also, if you're looking to go to another similar event, remember registration is still open for the free Philadelphia Transgender Health Summit. So watch for that coming in June of this year. And you know, we always have to end on a good note. So after recently covering bias in medical schools, we have a bit of a crush this week for the Paul L. Foster Medical School in El Paso, Texas. They've started a Safe Zone LGBT Allies training for medical students. No small matter when 81% of medical students have shown anti-LGBT bias. Safe Zone graduates even get a rainbow pin for their white coats to show LGBTQ patients that they're queer friendly. This is great, and we hope more medical schools follow Foster's lead. That's it. That is all your stories for this week. Please join us next week and every week. If you like us, subscribe and share. And remember, we're the place to get all the information you need to know about our community's health. Bye.